Hives facts. Hives, medically known as urticaria, are red, itchy, raised welts on the skin that appear in varying shapes and sizes. Each one characteristically lasts no longer than 6 to 12 hours. Although hives are very common, and their cause is often elusive, hives can change size rapidly and move around, disappearing in one place and reappearing in other places, often in a matter of hours. Ordinary hives flare up suddenly. Occasionally hives are produced by direct physical stimulation by environmental forces like heat, cold, and sunlight. Treatment of hives is directed at symptom relief until the condition goes away on its own. Antihistamines are the most common treatment for hives. Hives typically are not associated with long-term or serious complications. Hives can also develop as a result of sun or cold exposure, infections, excessive perspiration, and emotional stress. The reason why stress seems to precipitate an outbreak of hives in many people is not completely understood but is likely related to the known effects of stress on the immune system. In many cases, the cause of hives in a given individual cannot be identified. Read more about causes of hives, what are hives, urticaria, and angioedema. What do hives look like? Readers' comments 100. Share your story. Hives, medically known as urticaria, appear on the skin as wheals that are red, very itchy, smoothly elevated areas of skin often with a blanched center. They appear in varying shapes and sizes, from a few millimeters to several centimeters in diameter anywhere on the body. It is estimated that 20% of all people will develop urticaria at some point in their lives. Hives are more common in women than in men. One hallmark of hives are their tendency to change size rapidly and to move around, disappearing in one place and reappearing in other places, often in a matter of hours. An individual hive usually lasts no longer than 24 hours. Outbreak that looks impressive, even alarming, first thing in the morning can be completely gone by noon, only to be back in full force later in the day. Very few skin diseases occur and then resolve so rapidly. Therefore, even if you have no evidence of hives to show the doctor when you get to the office for examination, the diagnosis can be established based upon the accurate recounting of your symptoms and signs. Because hives fluctuate so much and so fast, it is helpful to bring along a photograph of what the outbreak looked like at its most severe point. Swelling deeper in the skin that may accompany hives is called angioedema. This swelling of the hands and feet, as well as the face, lips, or eyelids, can be as dramatic as it is brief. What causes hives and angioedema? Are hives contagious? Does stress cause hives? Hives appear when histamine and other compounds are released from cells called mast cells, which are normally found in the skin. Histamine causes fluid to leak from the local blood vessels, leading to swelling in the skin. Hives are very common and are not considered contagious. Although annoying, hives usually resolve on their own over a period of weeks and are rarely medically serious. Some hives may be caused by allergies to such things as foods, infections by different organisms, medications, food coloring, preservatives and insect stings or bites, and chemicals, but in the majority of cases, no specific cause is ever found. Although people may find it frustrating not to know what has caused their hives, maneuvers like changing diet, soap, detergent, and makeup are rarely helpful in preventing hives unless there is an excellent temporal relationship. Since hives most often are produced by an immune mechanism, the condition is not contagious. If an infectious disease were the cause of hives in a particular person, then it is possible, but not likely, that an infected contact could develop hives. Having hives may cause stress, but stress by itself does not cause hives. What are the different kinds of hives? Hives fall into two categories on the basis of the time they have been present: acute urticaria, ordinary hives, which resolve after 6 to 8 weeks, and chronic urticaria, that continues longer than 6 to 8 weeks. Since hives are so common and acute urticaria, by definition, resolves spontaneously, physicians do not generally expend much time or expense to evaluate the cause of hives of less than 8 weeks duration. What are the signs and symptoms of ordinary hives? Readers' comments 6. Share your story. Ordinary hives flare up suddenly and usually for no specific reason. Welts appear, often in several places. They flare, itch, swell, and go away in a matter of minutes to hours, only to appear elsewhere. This sequence may go on from days to weeks. Most episodes of hives last less than 6 weeks. Although that cutoff point is arbitrary, cases of hives that last more than 6 weeks are often called chronic. What are the risk factors and causes of ordinary hives? As noted above, many cases of ordinary hives are idiopathic, meaning no cause is known. Others may be triggered by viral infections. A few may be caused by medications, usually when they have been taken for the first time a few weeks before. It is less likely for drugs taken continuously for long periods to cause hives, but certainly not impossible. When a medication is implicated as a cause of hives, the drug must be stopped, since testing is rarely available to confirm the cause. In most cases, drug-induced hives will go away in a few days. If a drug is stopped and the hives do not go away, this is a strong indication that the medication was not the cause of the hives. Some medications, like morphine, codeine,